The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, this is a big topic, new breakthroughs in hearing technology. With us, we have a audiologist, a doctor in audiology, Dr. Natasha Dewald. Dr. Dewald, welcome to the program.
Thank you.
Now, you're the founder, or your business has helped you hear.
Yes.
Is that correct?
Yeah.
I had you on the show 7 years ago.
7 years.
You haven't aged.
Yeah.
Maybe we should start with what's your secret first, right? But for people that don't know about your practice, help you hear, who's the typical patient that comes in? I guess all ages.
All ages, mostly adults.
Okay.
Either somebody who suspects that they have some hearing loss and want us to diagnose it, or people that have purchased hearing aids from other clinics and are not getting results. Yep.
And people need to know, and I'm trying not to endorse you today, but I'm a big fan, by the way. Okay.
Thanks.
But people need to know that you're pretty much going to pay about the same wherever you go. Mm-hmm. So you might as well go to an audiologist.
Right, somebody who's educated.
Okay, but what does that mean to the patient? I mean, how important is the fact that you are an audiologist, or they just go to some dispenser?
Well, it starts with the right diagnosis. If people come to us and they've got a very complicated hearing loss and it's not diagnosed properly somewhere else, then they're probably going to have the wrong prescription, the wrong technology.
The wrong hearing aid.
The wrong hearing aid.
Okay, so
our education gives us that ability to do the proper diagnosis, but it also gives us the ability to understand the technology for the best rehabilitation.
Okay, which means what? Best rehabilitation? Best
clarity. That the hearing aids are not just making their world louder, it's making it sharper and clearer.
Okay, at the top of the show I said there's new breakthroughs in hearing aids. Is that true?
Yeah, it's
exciting.
And
what are they?
The most exciting thing we're dealing with right now is a technology called Sound Recover. And the other new breakthrough is called Lyric. It's an extended wear device that you wear 24 hours a day, 7 days a week.
Goes in the ear. It's called the invisible hearing aid.
It is.
Must be hard to put in if it's invisible.
Well,
right?
Invisible for you to see, but
okay.
We do it under microscope.
All right. Now we have Dr. Baker coming in the second half of the show. So these new breakthroughs, let's go right there.
Okay.
This Lyric. What is it? And then Sound Recovery. There's two things we're going to talk about.
Yep. So the Lyric is what we were just saying.
Invisible?
It's invisible. You wear it 24 hours a day, 7 days a week. You shower with it. You sleep with it. It's effortless hearing because you don't have to change the battery. You don't have to clean it, and it doesn't show.
Now, you're one of the only places, I guess in the desert, as of today's date, of the taping, that offers this in the ear.
Absolutely.
Is it like an implantable hearing aid? What is it?
It's a deep insertion hearing aid.
Okay.
Under microscope, we place it 4 millimeters from the eardrum, so it picks up all the natural acoustics of the ear canal.
Okay.
And we are the provider.
You're the only provider at this point. And so and I know the prices, so these are low priced. These are not expensive hearing aids.
No.
And you say you could swim with it, you could hike with it.
You can do everything. If you're active, and in the desert, it's windy. And people complain a lot about the wind, but with this device being so deep into the ear canal, you don't pick up any wind noise.
All right, so you advertise it as what? The Lyric, the invisible hearing aid?
The Lyric.
The Lyric.
Yeah.
In the ear.
Extended wear.
Let's begin then with this new Sound Recovery hearing aid.
Yeah.
It's called the Phonak.
Phonak's the brand.
All right.
Sound Recover's the technology inside. Most of the time that people complain about hearing loss, it's not about the volume, it's about the clarity. And that really has to do with an area of the inner part of the ear that loses its ability to understand speech. And those are the higher frequencies. Well, traditional hearing aids just amplify those higher sounds. But if you've got distortion, if your inner ear is not working properly, making it louder doesn't make it clearer. So why bother? Phonak with Sound Recovery has developed a way to compress those sounds, shift them to a lower frequency where the hair cells are healthier, and your brain puts it back into the right pitch. So instead of amplifying the damage, I'm bypassing the damage.
So the words are heard better.
Sharper and clearer.
Sharper, clearer
and I hesitate to use the word restores hearing because that's very deceptive, but in functional terms, we can prove that it will restore the word understanding for clarity.
I told you my dad. I said that because he was a musician, I said his ears are blown out.
Yeah.
and he uses some hearing aid. They just make everything louder.
Yep, but
you
not
say
clear.
he's perfect.
Yes.
For this new sound recovery. Why?
It's because it's designed for people that have so much damage in their hair cells that if they put on a traditional hearing aid and made those hair cells louder, it would be distorted. And your dad probably complains that it's loud, but it's not clear. I hear all the unwanted, I don't hear the wanted sounds. And this technology, by bypassing the damaged part in the ear, makes it clearer.
Now, when you were on my program before, I don't remember talking about hair cells.
Okay.
Tell me how that plays a role in hearing.
Yeah, as the sound goes into the inner part of the ear and the eardrum vibrates the bones push on fluid, which vibrates these little hair cells. And inside our cochlea, we have thousands and thousands and thousands and thousands of rows of hair cells.
Okay.
Each row constitutes a pitch. So when people have hearing loss, like a musician in the higher pitches, it means those little sensory hair cells are damaged. They're not completely gone because your dad's not deaf.
He can hear low sounds.
He can hear low sounds, exactly.
Okay.
So his high frequency hair cells are shot. So if they're shot, why try and make them louder? If making it louder...
So whatever hearing aid he has, if he doesn't have this, all it's doing is amplifying.
Amplifying.
And so you're saying this...
This does not amplify the damaged hair cells. It compresses it, shifts it to a lower frequency where the hair cells are healthier, and the brain extrapolates it. So it's bypassing those damaged hair cells instead of amplifying the damaged hair cells. And results. We've taken people when they're in a sound booth and we're testing their word clarity. They may understand 30 or 40% of speech. Quiet environment, no background noise, good talker. They still misunderstand 60 or 70%. We put on a phonak with sound recover, and after 3 to 4 weeks of rehabilitation, they're now understanding 80 and 90% clarity. It's restoring that quality of life. It's restoring people's ability to understand and participate again.
What are people saying that you've put this lyric, this brand new, I guess I'm calling it a breakthrough.
It is breakthrough. They're saying it's the closest thing to natural hearing that they can ever remember.
Okay, these are hearing aid, people just tuning in, we're talking about a new breakthrough in hearing aid technology. Sound recovery helps you hear words better. And for people like my father, the musician, you say that he only hears low tones. This will allow him to hear those high pitches again. Okay?
Yeah,
but
awesome.
The people that have hearing aids already, that have made the switch, that's my question. What are they saying?
They're saying it's like nothing before. It's not louder, it's sharper and clearer. And not just speech. I have a patient who was trained in classical music, and right after he did his training, he lost his hearing at the age of 30. He's now in his 80s. He's worn hearing aids for 40 or 50 years. He says it's the first time since he was 30 years old that he was able to appreciate his classical music, because it's bypassing the damaged hair cells and stimulating the auditory nerve in those higher frequencies. It's life-changing.
Interesting. And right now you have to go to an audiologist to get this done. Okay, so that's important to know.
Absolutely.
And pricing, we want this to be, these are real interviews. I mean, we didn't script any of this.
Right.
But the truth of the matter is, it doesn't cost more to go to an audiologist than it does.
Less.
And is this true? If I wanted to be an audiologist, or not audiologist, but if I wanted to be, buy hearing aids, set up shop in Palm Desert, buy a white lab coat, right? Yep. I could do that in a couple of days.
Couple of days. You pay a fee to the state of California in Sacramento. The requirement is a high school degree, and you're granted a license to sell a hearing aid. So just because you wear a white lab coat doesn't mean you know what you're doing.
So look for an audiologist.
Look for an audiologist.
Okay,
preferably a doctor of audiology.
So like, when you talk about these big chain stores and things like that, are you saying that people are in the desert, there's thousands, that have hearing aids that they're not properly fitted for?
Yes. Sadly. We get it every day. People come to us and they've purchased hearing aids at wherever, and they are the wrong prescription, the wrong size, the wrong technology. It's loud, but it's not clear. They still can't understand on the telephone. They still can't understand at church. They still can't understand at their group meetings. And they may have spent a small fortune on it, and it's not improving their hearing.
Okay, so this new sound recovery called the phonak, and there's two categories. People that are watching this and maybe their family is watching this, that they've never tried a hearing aid.
Right.
There's that crowd.
Right.
Then there are those with hearing aids that now have an option to hear clearer.
Right.
Let's talk about the people, though, that are doing nothing.
Okay.
Maybe their family, it's driving them crazy.
Yeah.
What do you say to them?
Well, first off, come and be tested. because we're not about high pressure sales. It's about finding out what the ear level is and seeing if they even need a hearing aid. Sometimes it's not enough hearing loss to need intervention, to need rehabilitation.
Is it free, your consultation?
Consultation is free.
Okay, good.
Being an audiologist, we can bill most insurances for the evaluation. So we can bill Medicare, we can bill a lot of private insurances for the evaluation, but the consultation is free. So those people that their wives or their spouses are complaining that the TV is too loud, or they have to hand over the telephone to a loved one because they can't follow the instructions on the phone, or the radio's up too loud, or they're asking people to repeat. Those are signs that they probably have a bit of hearing loss, that they should at least come see us so we have a baseline.
Okay, you know, I knew a guy in the desert, okay? Well-known guy, and he was a surgeon, actually. I think he's retired now. But he was known as the guy that couldn't hear. But he didn't know that. I mean, do you find that it's like their family, everybody talks behind their back?
Yes.
Oh, try talking to him. It's like you avoid this guy. I would, walking down El Paseo, right? Signing a few autographs, right? No, I'm kidding. Walking down El Paseo, and it's like you see him, and because you know he can't hear what you're saying, and he dominates the conversation. And you say this is typical.
Yeah, they talk a lot because if they stop talking, they have to listen, and they can't. And usually the person with the hearing loss is the last one to know how much hearing loss they have, because the spouse allows them to turn up the TV a little bit. They don't recognize how much they're asking people to repeat. Huh? What? What was that? What did you say? And it becomes a habit. So they don't know how much hearing loss they have.
And so it's, and I know 7 years ago you told me that usually it's the family that drags them in.
Usually.
Even somewhat of like an intervention that goes on?
Yeah.
Where more than one family member will say, you got to get in there?
Children, grandchildren. And that's a big one when the person starts to realize that they can't understand their grandchildren. It's usually the grandchildren that say, Grandma, Grandpa, go get your hearing checked, because they're missing that. And that's, you know, life is short. You got to capture those moments.
Now, when they, you know, people are working now, 70, 80, they're working. Many people like to, because they're healthier today. And so what is your experience as far as hearing affecting their job, their
it
career?
Affects the amount of income. Like if you're a contractor and you're placing a bid, but you misunderstand the terms of the contract that you're bidding for because you misunderstood it, maybe you're not going to get that bid because of it. Or a receptionist who works in a doctor's office, she's trying to write down phone numbers, but she gets a 5 and a 9 mixed up because she can't understand what's being said on the telephone.
So the perception might be they're not very bright.
Possibly. They're ignoring.
Everybody's, I mean, are they worried about looking old?
Yeah.
It's
a stigma. But these devices are not your grandmother's devices. They don't look like hearing aids anymore. In fact, some manufacturers call them personal hearing devices because it looks maybe like a Bluetooth, or it's invisible like a lyric.
I mean, nowadays, what if you have substantial hearing loss? I mean, you don't need an outside the ear.
You don't have to. Or if it's outside, it's so minuscule that people don't know that you're wearing it. But from my perspective, if you're asking people to repeat and you're turning up the television, or you're ignoring or you're answering incorrectly, people in your life already know you have hearing loss, so who cares if they see a tiny little device? However, once people come to us and we put a device on and they look in the mirror, they go, wow, I can't even see it.
Interesting.
And then they start to hear it and they say, oh, you know what, who cares if somebody sees it? This is awesome.
You know, I'll tell you, you know, when I talk to people or interview people, and it's tough to talk to somebody, and also it's frustrating to talk to somebody that can't hear what you're saying.
It is.
Do you think that they don't even know that they're missing part of the conversation? Is that possible? Like they're missing certain words?
Yeah, they fill in the blanks. If they can see, very often people will sit with me and say, this is fine, I hear you fine. But when my wife goes up to the refrigerator to grab a soda, I can't understand her because she's talking from another room. Maybe, but maybe it's because they can no longer see and they can't fill in the blanks.
Interesting.
Okay, so the brain, if they're smart and they've got some vision, their brain is filling in. On average, it takes a person 5 to 7 years from the time they should receive a hearing aid to the time they do receive a hearing aid, because the brain has to be convinced that there's that much hearing loss to need intervention.
Now with, and the age ranges, by the way, in the desert of people.
It's getting younger and younger.
Really?
My average age used to be in their 80s. Now we're fitting patients in their 30s and 40s. And that's because of noise exposure. Baby boomers in their 60s are coming in for technology, and that's because they listen to a lot of rock and roll music. Your father probably damaged his hearing from his music experience.
As a band leader, yeah.
Yeah, and so hearing loss is getting younger and younger, but technology is also getting high tech. You can interact technology with Bluetooth. You can go wireless to your television. You can go wireless to your cell phone. You can stream it into both of your ears.
Okay.
It's high tech. So
now, people just tuning in, by the way, we're actually, you know, it's rare that we do this, but we're presenting a first in the desert. First place for two things. This new sound recovery for people that have been told their hearing is too blown out to hear the high pitches. This new technology does it. You're the only place as of today's date of the taping that has it. And then also this new invisible hearing aid, like implantable hearing aid. And so what are the frequently asked questions? Okay, so they hear about this sound recovery. The people with hearing aids already, but they want to pick it up a notch. What do they want to know when they come in?
They want to know how. How is that possible? And how is it possible that I have hearing aids in the drawer that are a year old and you're telling me this technology is going to be a lot better? They also ask how much, and they also ask what happens if I don't like it. And yeah, right, that's a lot of money, or they think they're spending a lot of money. It's actually one of the most economical technologies out there, and we offer 60 days to try it with 100% refund. So you've got nothing to lose.
Okay, let me get this straight. Okay, so without sounding salesy here, because if somebody's watching this, maybe we should talk slower too, because they're hearing. We want those people to watch this. They go in, they get tested. Doesn't cost money because you're an audiologist. They're not paying more for the hearing aid. Also, you could bill insurance. But more importantly, they could walk around with it, listen to it for a couple of months. If they don't like it, they come back and get an entire refund? Really?
100% of their money back. And instead of just popping it on them and just letting them out the door, we do a lot of post-testing, post-fitting testing to make sure that the prescription is accurate and that word understanding improves. And we will test over that 60-day trial period to prove to the consumer, the end user, that their word understanding is improving, which for most people it's obvious because the TV volume goes down, the wife or the husband doesn't have to repeat, they can participate in conversations again, and hearing does become effortless. But we're the science behind it. We want to know scientifically how much is it improving their intelligibility.
Do they all say it's okay? It's a little better. I mean, do they brag about it?
They brag about it. They love it. It's gotten us really busy that people will be fitted and the next day their friends are calling, I want what Mr. Jones has. I want what Mrs. Smith has, because they walk around going, this is the best technology ever, and I didn't have to spend top dollar.
Yeah, it's not a lot of money.
It's not.
Nobody would disagree with that. Okay, so go to an audiologist. Now, we also have a clip.
Yes, I do.
Okay, we're going to go to the clip, and what are we going to look at, by the way?
We're going to look at animation explaining high frequencies, how you don't hear them naturally with hearing loss, and how sound recovery compresses it and bypasses so you can hear it.
Okay, so this is, if you have a hearing loss for high pitches, you got to watch this. So you'll narrate this whole thing. Okay, we're going to take a look.
So these keys on the piano represent the frequencies in hearing, and the grayed out ones are the higher frequencies that are not audible for somebody with high frequency hearing loss. Sound recovery then compresses those higher frequencies, shifts them to a lower key or a lower frequency, and so it becomes audible to the auditory nerve. And they can hear it.
And that's accurate. You can use that with, I mean, you could verify that with testing in your office?
Absolutely. Yes, we do.
Very good. Very, very interesting. So it's, and do they ask for it by name? Do they say, you know, I want the sound recovery hearing aid?
Not yet.
Not yet?
It's too new.
The challenge, if you're out there and you're wearing a hearing aid, more than a year old, even 6 months old, that, and high frequency is your problem, you could come in, try it,
and even if high frequency is not your problem, it doesn't have to be just for high frequency hearing loss. So don't put the limit on it. Anybody who's not understanding with their current technology, come see us.
The words.
The words. They hear, but they don't understand. Come see us, and we can decide if the phonak is right.
Wow. Okay. With a 60-day
money
back guarantee. All right. Well, this will cause. I hope it doesn't cause like a mob scene in the streets.
I hope it does.
You hope it does. Okay. We're talking about hearing, new breakthroughs, even an invisible hearing aid. Up next. We'll be right back. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez, and today's topic: what you need to know about new breakthroughs. I mean, these really are fresh breakthroughs. This is a first. Has this been presented in the news in the desert yet?
No, not yet.
This new? Okay, so we're breaking it here.
We're breaking
finally.
it, yeah.
Okay, good.
That's why I'm here.
It's called sound recovery. for people currently with hearing aids.
Yep.
Give us a quick recap.
Okay, well, this new technology we're talking about is not only to make sound sharper, but it makes it clearer. It bypasses the damaged hair cells in the inner part of the ear, compressing the sounds, shifting it to a lower frequency where the hair cells are healthier, and the brain extrapolates it. So instead of amplifying the damaged hearing, I'm bypassing the damaged hearing, and I can make somebody's world clearer.
Okay, your father. You say your father has switched from an old hearing aid, or maybe not so old.
Not so old, just a few years ago. We fit him with what was state of the art then, and a couple of weeks ago I fit him with Phonak with sound recovery, and he said, hands down, it's the sharpest, clearest, most natural hearing he can ever remember. And he lost his hearing through rock and roll music and cars. He used to be a drag racer.
Oh, really?
So he's that typical high frequency, I hear you, but I don't understand you. And it's the volume of his TV's gone down. He's enjoying sound naturally.
Okay, so I mean, it's your father, but he's saying totally different.
Totally different. He said it puts the other hearing aids to shame to the point where he gave them to me to donate them because he doesn't even want to use them as backups.
Really?
Yeah.
Is that right?
Has no intention of putting the old ones on. And the old ones, he would forget to put them on. And if he left the house, he wasn't motivated to go back and put them on. Now, it's the first thing after he's done with his shower in the morning. He never leaves the house without them. He wears them as often as he can.
Okay, so this is your father, but other people are saying the same thing.
Same thing.
So everybody you fit, are you ever surprised with their reaction?
Well,
and do you think
now
you're changing,
I'm not.
Do you think you're changing some lives here?
Absolutely. Tears of joy. We get lots of hugs. People tell us how they're able to communicate with their families again. The gentleman with the classical music, he's appreciating his stereo again and his music. People can understand the lyrics in the car when they're with their families. It's life-changing. It's awesome.
Now, you're an audiologist, so of course you think hearing is important.
Of course.
Okay, but for the people that they're missing out.
They are. They are. They're missing out either their grandchild's recital or their meetings at the golf resort, or they can't hear their buddies on the golf course. Every aspect
There's
of life.
people that even avoid charity events, dinners, outings. They can't sit at a big round table.
Yep, they socially recluse. They pull themselves away. They say, what's the point? And I've tried hearing aids and they don't work. So what's the point? Try it. You've got nothing to lose. You've got 60 days to return it and get your money back.
Well, I want to thank you for coming. We're going to have your partner on next, the invisible hearing aid. It's not actually invisible. It just goes in the ear so nobody can see it.
It's so deep that, you can't
And it has to be put in right now by audiologists.
Yes.
Is that correct?
Yes.
Okay. We'll be right back. More about breakthroughs in hearing. We'll be right back.
Huh? Don't miss out on any more conversations. At Help You Hear, you'll find audiologists who are committed to finding the best solution to fit your needs.
They're not here to sell you a device. They're here to help you hear.
We know hearing loss can be difficult. We promise to treat you with respect and give you excellent service every time.
They have customer service down to a science.
I have had a wonderful experience.
Call us today for your complimentary consultation. We will help you hear what you've been missing.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, new breakthroughs in hearing instruments. With us, we have a audiologist who's well known in the desert, works with Help You Hear, Dr. Baker. Dr. Baker, welcome to the program.
Thank you.
Now, we had you in the program about 4 years ago.
Correct.
And but a lot has changed. I mean, what's new? You know, we had Dr. Dewald on here today.
Yes.
What's new?
A lot of things are new. Hearing aids have gotten smaller, better, and the new Lyric device is a new revolutionary device that was featured on Dr. Oz and on Oprah.
Invisible hearing aid.
Correct.
Okay, and you have one on?
I do.
Tell me about it. What's it like? I mean, how is it different than what you had before?
It's different in that I don't have to change batteries. I don't have to remove it to shower or be outside in the wind. I don't get wind noise like I did with my other devices when I was outside.
No wind noise.
Because it's placed deep inside the ear canal, your natural ear is filtering all of the sound from outside into your ear, and it's also keeping out things like wind noise.
Who puts yours in, by the way?
Natasha will put it in.
Dr. Dewald.
Or I can put it in myself because.
Oh, really? But the regular person doesn't.
The regular person is not meant to remove and insert the device on their own. They would come to someone like me, and it can last anywhere up to 4 months, and then it's removed and a whole new device is inserted.
Okay. Now, So it could last 2 to 4 months without changing batteries or whatever.
Absolutely. And
You
me
sleep with it,
personally,
everything?
I sleep with it. I don't turn mine off. There is a way to turn it off, turn it on, put it into a sleep mode, as well as control the volume. But I just leave mine on all the time. So I get a less battery life out of it because of that.
So you could have any hearing aid in the world, and you pick this one.
Fortunately, yeah.
And you pick this one.
Yeah, I did.
Okay.
I've worn traditional devices for many years, and I decided to try this because it was something new. I didn't really think I was going to be wearing it. I wanted to see what it felt like, so
Because you were going to be selling it, offering it.
Absolutely. And I wanted to be able to tell my patients what to experience, what they would experience, how it would feel. And
Are you hooked?
I am.
Now,
You can try it.
We're going to go to this clip in a minute. This is the new invisible hearing aid. I'm calling it invisible hearing aid, but it goes in the ear. You insert it. It has to be done by the audiologist. But something else, because there's thousands of people with hearing aids in the desert.
Correct.
This not only is a money-back guarantee in 60 days, but they don't have to even give you money for 60 days. Is that true?
With the Lyric device, there's a 30-day free trial, and you're under no obligation to purchase. But the 30-day free trial is you get to we insert it, you get to run
Wear
it
it for a
around,
month.
you play golf in it, you go horseback riding, whatever.
It's like the hair club for men.
Exactly.
You get to do all these fun things once you get the hearing aid. Okay.
And then you, at the end of the 30 days, you're asked if you're interested in pursuing this device.
What type of hearing loss, and we'll go to the clip, but what type of hearing loss can you have to be a candidate for that?
For the Lyric, you can have a mild to moderately severe hearing loss, meaning down to about a moderate degree of hearing loss in the low pitches and a severe hearing loss in the high pitches. So it's quite a range, but it doesn't fit people with like profound hearing losses or deafness, but everybody in between.
All right. Okay, so we're going to go to this clip.
Okay.
All right, let's take a look.
So the Lyric is a very small device, as we talked about earlier, and it's going to be placed deep into the ear canal. It doesn't hurt. It's very small. There's no surgery involved, of course, and it fits way down, and it is invisible, as you said earlier.
Interesting. So it's way in there.
It's very deep into the ear canal.
And yours is comfortable.
Mine is comfortable. Doesn't cause me any problems whatsoever.
I want to thank you for coming on the show. Very good.
You're welcome. Thanks for having me.
Always a pleasure to have both the doctors, Dr. Dewald and Dr. Baker, on the program. Now, this is all on your website?
It is.
Is that correct? Okay. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, you can go on our website and at wellnesshour.com and just put in hearing or Dr. Dewald or Dr. Baker. You'll find it there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.